Hi, my name is Shazeen Suleiman, and I'm the lead author on this study exploring stakeholder service navigation needs for children with mental health and developmental diagnoses, led by our lead author, Widya Seen, an outstanding medical student with us at the University of Toronto. We all know that many children in the United States have one or more developmental disabilities, rated seems to be at almost more than 1 in 5 children. But despite this high number of children that do have developmental or mental health disabilities, few have access to the necessary clinical, community, and social services to support their diagnoses. This may include therapy, funding opportunities, specialized schools, and respite. And as this becomes increasingly difficult for families to navigate this fragmented system, service navigation programs can be an attractive solution, but they can differ widely in how they're implemented and can be even more difficult to implement in resource-limited settings with diverse patient needs. And in order to create effective service navigation programs in these settings for these families, it is important that we do so by understanding their lived experiences and perspectives. And that was what we set out to do in our specific study. We wanted to explore diverse stakeholder perceptions in a pilot service program that we created in an urban inner city context. And in particular, we wanted to focus on exploring their experiences trying to access services before the program was implemented, and in their opinion, what were elements of a successful service navigation program. The purpose of this was to refine this model so that we could begin to offer a service navigation program in our clinical context. And what we did is we created a pilot navigation program. And in summary, the way it worked was that a physician, either a pediatrician or a developmental pediatrician, would refer the family of a child with a new or existing diagnosis to a dedicated service navigator. And this person was hired with the impact that they were going to have was be specifically for service navigation and no other role. And what they did is they would meet with the family, determine what needs they had for specific therapy, such as speech therapy or occupational therapy, community support such as daycare, and any funding opportunities they may be eligible for. And then they would help the family complete the necessary paperwork and applications, and then coordinate as needed for ongoing follow-up or support with completing new forms or other applications as they arose. And this was a qualitative study where we interviewed 25 participants from a diverse stakeholder group that included not only healthcare practitioners, such as pediatricians, but also allied healthcare administrators and caregivers. These interviews were recorded and transcribed, and then we explored themes across and within each stakeholder group. And what we found was that patients and providers identified a clear need for service navigation in our respective inner city neighborhood. Providers talked about the difficulty in not being trained or knowing how to support families and needing somebody to assist them with that. And caregivers talked about the bewilderment that they faced when they were asked to approach different agencies to support their child, but they didn't really know where to start. They also identified across both caregivers and team members that certain patient populations were identified as needing greater navigation support. And this included families who were living in poverty, families who had immigration barriers, limited English proficiency, low social support, and poor parental mental health. And this quote from a developmental pediatrician identifies some of these marginalized experiences that may contribute to requiring even more support. And most interestingly, providers and caregivers reported that in their opinion, an effective service navigator had very specific skills. The first, unsurprisingly, was that it was a strong knowledge of community services, knowing what was available, who was eligible, and how to actually complete forms. They also required excellent advocacy skills. And this was more about how to help families when speaking with agencies or schools. And even more powerful was the expression from different caregivers of the need for strong interpersonal skills, being able to listen, being able to provide an empathetic response. And again, this quote from a caregiver highlights some of those skills that were identified. What we did with this information is revised our model of service navigation to incorporate these experiences. And in this case now, children with existing developmental or mental health diagnoses and social barriers, including some of the ones identified, are referred to our program, in addition to those that have been newly diagnosed. And again, the service navigator completes more of a standardized intake assessment to really help capture what are the specific needs of families, and then creates a support plan to walk with them through their journey. So that may be completing the applications as identified, connecting them with various community services, helping look for funding applications, and also providing emotional support and guidance to caregivers, and acting as a liaison between the caregivers and the medical team. Our findings show that service navigation does play a unique role within the healthcare team and highlights their specific competencies. Our program hopefully suggests that a personalized approach to service navigation can actually be a solution for these families, particularly those that live in communities that experience a high degree of marginalization, such as the one that this study was conducted in. And it is important to partner with each family from the moment the diagnosis is made, centering on the needs of each family. For you to consider, how might service navigation and respective needs look in your clinical setting? And how can we train more people to be effective service navigators? Thank you for listening, and I hope you enjoy reading our paper.